So this is now part 14 of emergencies in first aid, and we'll talk about cardiac arrest. Cardiac arrest is when the heart stops beating. So because the heart is not beating, if you palpate for, let's say, the carotid pulse, you'll not be able to feel the pulse. So there is a cessation of the heartbeat. What are some of the causes of cardiac arrest? Electric shock, cardiogenic shock, neurogenic shock. What are some of the signs and symptoms that you see for someone that is in a cardiac arrest? So there's not going to be any carotid pulse. Remember, the heart is not beating. There's no respiration. The pupil is also fixed, meaning that even if you expose it to light, normally if the pupil is exposed to light, it's supposed to be able to react, but then the pupil will not be able to react. That is why you see medical personnel with those small touches, okay, which they do point in the eye. And the pupil is also going to be very much dilated. There's also going to be cyanosis, which is the skin becomes bluish. A person can also be in a coma or unconscious. So if someone is in a cardiac arrest, the heart is not beating, you can make the heart to start beating by performing a cardiac resuscitation or cardiac massage. So there is a closed cardiac massage. So this one, what normally happens is, ideally it's supposed to be operated by two people. Okay. So two operators should work together if cardiac and respiratory resuscitation might be combined. So if you want to perform a mouth to mouth and then you want to make sure that the heart starts beating, two people are supposed to do it. You are going to place the victim in the recumbent position on a firm surface, not on something like the bed. They should be firm. To find whether you should apply to find where you should apply the compressions, place your index and your middle fingers on the xiphoid process. When you do that, you are going to place the heel of your hand just above this on the sternum. So what you have done is your index finger and your middle finger, you've placed them on the xiphoid process, and then you place the heel of your hand just above this, just above that point on the sternum. That is why you're going to be able to perform your cardiac resuscitation. And then you are going to place the other hand on top of the first and then interlinking your fingers. You are going to keep your elbow straight, rock your body back and forth over your hands, like you are pushing now your hands like that. As the weight of your body moves over the heels of your hands, you are compressing the chest. As the weight of your body moves back, you release the compression. Each compression should make the sternum depress about 5 centimeters. You need to keep your fingers off the chest wall as they may cause additional damage. The chest should be compressed at a rate of 1 compression per second. The heel of your hand should stay in contact with the chest throughout the compression and release of the chest. If both cardiac compression and mouth-to-mouth resuscitation is required, the second operator gives mouth-to-mouth resuscitation as follows. The first operator phase is going to inflate the chest 1 time and stops. The second operator will compress the chest 5 times and stop. Repeat these steps 1 and 2 until breathing and heart rate resumes. Okay? So when the heart rate and breathing starts without you helping, that is when you should stop. The first person first is going to inflate the chest. How do you inflate the chest? By performing a mouth to mouth, you push in your air. And then the second person is now going to come in and do a cardiac compression. You press the chest, you release like that 5 times, and then you stop. And then you repeat the procedure. So the mouth to mouth you are doing it once, the cardiac compression you are doing 5 times. If there is only one operator, then she inflates the chest twice, finds the hand position on the sternum and compresses the chest 30 times. Okay, just like that. There are some guidelines for administration of cardiac massage. Resuscitation should continue until the victim is breathing naturally or until the doctor has stated that the victim is dead. As long as these two conditions are not met, you need to continue performing the resuscitation, the mouth to mouth and the cardiac massage. If the heart is beating, there is hope that the victim will recover if respiratory resuscitation is kept up. Success of cardiac resuscitation is noted when there is a palpable pulse. So for you to know that, okay, now the heart has started beating, you are going to be able to feel a pulse. You can perform a carotid pulse. If you feel it, then you know that there is a success. Also, when there is improvement in the color, we said that the person will have cyanosis, meaning that there will be bluish color. If the color is improving, then you know that, okay, what you are doing is working. And when there is contraction of the pupils, and when there is a reappearance of hemorrhage from any wound, then you know that something is happening. Failure or success is usually decided within the first 15 minutes. So if you've been performing the cardiac resuscitation for 15 minutes and nothing is happening, you will know that peradventure this person has died. Okay, so cardiopulmonary resuscitation, also known as CPR, is a combination of mouth to mouth resuscitation and cardiac massage. That is what is known as CPR. In some situations, it is necessary to carry out mouth to mouth resuscitation because the heart is still beating. Okay, I mean, it is only necessary to carry out mouth to mouth resuscitation. If the heart is still beating, there's no need of you performing those cardiac compressions. So just perform the mouth to mouth resuscitation so that the person can start to breathe. However, in this situation, it is important to regularly assess the carotid pulse. You are assessing the carotid pulse to make sure that the heart has not stopped. If it has then, if it has stopped, then mouth to mouth and cardiac massage will be necessary. That is, you need to perform a CPR. So that is it on this one. Thank you so much for watching. The next class will talk about wounds and how you should be able to manage them.